Hello. My behavior change project worked on the reduction of a 7-year-old boy with autism's vocal stereotypy behavior. Charlie, the 7-year-old boy, is in 2nd grade and was diagnosed by a medical doctor with autism spectrum disorder at age 3. Charlie has significant delays within communication and social skills. Charlie has an individualized education program at school along with a one-on-one aide. He also attends ABA therapy for 2.5 hours a day, 5 days a week. Charlie engages in vocal stereotypy throughout the entire day, and it has been reported that his vocal stereotypy interrupts his learning and his ability to engage with his peers. The setting in which the intervention takes place is a clinical setting within his ABA therapy. The data was collected throughout the entire 2.5-hour session. Charlie works with a trained one-on-one therapist and has 3 other peers in session with him. Vocal stereotypy, also known as scripting, is defined as Charlie repeating lines from movies, books, TV shows or commercials, or verbalizing words and phrases that are not relevant to the situation nor directed at anyone specific. Baseline data was taken for 5 sessions. During baseline, trained staff used tally marks to count the number of times that Charlie engaged in scripting behavior throughout the 2.5-hour session, both during appropriate times and inappropriate times. A voice-off visual was presented throughout the session when Charlie was not engaging in scripting behavior to pair the voice-off visual with reinforcement. Then, during the intervention phase, staff presented the voice-off visual to Charlie when he started engaging in scripting behavior at inappropriate times. Inappropriate times included working at the table, playing games with peers or staff, or while engaging in conversation with peers or staff. At the beginning of the session, staff would show Charlie the visual and prime him that when he sees his card, he needs to turn his voice off. If Charlie stopped scripting for the targeted amount of time after the visual was presented, staff would give him specific praise. If Charlie did not stop scripting, staff would start by gesturing to the visual, then giving a verbal prompt, and then engage Charlie in 3 to 5 echoic responses. Staff would then mark the data sheet according to whether or not Charlie responded to the visual and stopped scripting. During times where it was appropriate for Charlie to script, staff would ask Charlie to engage them in scripting by saying, "What are you talking about? Can I talk with you?" Appropriate times included when Charlie earned breaks or when he was transitioning between tasks. No data was taken on how many times Charlie was prompted to engage staff in scripting with him. Figure 1.1 shows that during baseline, Charlie engaged in an average of 58 scripting behaviors during both appropriate and inappropriate times. Instances of scripting ranged from 71 instances to 31 instances per session. During treatment phase 1, the voice-off visual was during treatment 1, using the voice-off visual cue, Charlie engaged in scripting behavior an average of 8.1 times during inappropriate times. The effectiveness of the voice-off visual ranged from being effective 72% of the time to being effective 100% of the time. Charlie mastered phase 1 at day 11 of intervention. During the 2nd phase, Charlie, as you can see here, engaged in 0 instances of having to be prompted. The visual was effective 100% of the time, so Charlie mastered phase 2 at day 4 of the 2nd phase. Charlie's average instances of scripting during the 2nd phase was 4.75 instances per session. The voice-off visual showed to be effective throughout the intervention. Charlie's scripting behavior was shown to be under stimulus control of the visual. The average instances of Charlie's scripting also decreased throughout intervention phases. The limitations of the study was that an FBA was not completed to show the function of his scripting behavior. Charlie's parents reported that his scripting occurs no matter who is around or what kind of tasks he's engaging in, but without completing an FBA, it is unknown of the true function of his scripting behavior. The second limitation of the study was that baseline taken was taken during both appropriate and inappropriate times that Charlie was scripting, and during his intervention phases, we only took data on if the visual was effective during inappropriate times. So it's hard to see the relationship, to see the direct relationship of the effectiveness of the voice off visual. The third limitation of the study would be that it was an A/B design, which is considered to be a weak design to show a functional relationship. Future studies may want to continue to implement the same procedure, but take baseline data on the frequency of scripting behavior only during inappropriate times. And future studies also may benefit from teaching the individual the difference between appropriate and inappropriate times to engage in scripting, as well as it is suggested that future studies do a A-B-A-B reversal design to gain a better understanding of the functional relationship.